Hello friends, today we'll be continuing our hair transplantation educational series, and here we try to understand different aspects of hair transplantation surgery with the help of some examples. So today we'll be discussing a case. This is one of my friends and tennis partner, Dr. Gupta. He's a pediatrician and he's around 62 years of age. So he came to us for a transplantation surgery. He wanted to fill up as much as possible, and if you see his pictures, pre-pictures, he had some hair in the frontal area. The sides were gone, the temples were gone. There were very few hair in the crown area. It was almost empty. When we evaluated Dr. Gupta, he had very tight skin over here. Now, as a rule of thumb, if we need big number of grafts, like in this case, we usually prefer doing a combination of FUT and FUE. So that was our obvious choice for him as well. But his skin on assessment was really very tight. There was hardly any elasticity. It was very tight. So we did the FUE. FUT was just not possible in this case. So this is an important point, that without assessing you, we cannot be really very sure about the method which we are going to choose. And the treatment has to be individualized, which is really very important. If we don't do that, we actually end up in a big trouble. So we went ahead with the surgery. We did 2000 FUE grafts for him. Now if you see his pictures of graft placement, we created temples for him. We kept a high hairline which actually suits his age. And if you see the 15 days post-op image, you can see the grafts have grown up in length, the scabs are shed, and the growth at this point also looks so natural. And the donor area has healed. Dr. Gupta is a big tennis enthusiast, so he was there on tennis court on day 6 and he was playing tennis. So this was very good and encouraging to see him, on tennis court that early. So now the temperament and the attitude towards life and sports actually helped in early growth of hair. Now we did a surgery around 3.5 months back, and if you take a look at his recent pictures, the area are nicely filling up, the shape is coming from the front, the temples are also showing up. But here a very important point which I would like to highlight is, look at his crown area where we didn't do any transplant. As you can see in transplant pictures, there were no grafts planted in that area. And if you look at his crown, it has filled up amazingly in just 3.5 months. So he responded very nicely to the medical treatment and PRP. So one PRP session was given to him at the time of surgery, and one PRP session was given to him at around 3 months post-op. So this area really looks very filled, and the hair growth is awesome in this area. We didn't do even a single hair in this portion. So this is actually very important, because when you see the results of different clinics, different patients, there are many patients who have some thin fine hair in that area where transplantation is done. So sometimes these patients respond to the medical treatment so nicely that a hair transplant result looks awesome, and the growth which you get is not only because of hair transplant, it is because of the improvement in existing hair, because of medications and PRP treatment. So this is really important, because sometimes patients when see the results, they are impressed, they keep very high expectations with the transplant surgery in some cases. And it is important, because if you don't have any hair, like in Dr. Gupta's case, if you see, he had hardly any hair growth in the crown area, but it is filling up so nicely. In some patients where there are thinned hair, better than what Dr. Gupta had, the filling of area could be even more and very nice. So it again gives us a message that not all the areas, if you have big areas of thinning, you should give a short to medical treatment and a session of PRP at least, if done properly, can really give you good results. It might reduce the number of grafts required to fill it up. So paying attention to these things will definitely help you. We'll keep updating you regarding Dr. Gupta's growth, and I'm sure he'll be having an amazing hair transplant result. So if you like the video, please press the like button. If you want more such information, you can subscribe to our YouTube channel. Don't forget to press the bell icon for regular updates. You can also follow me on Facebook. Thank you. Love yourself. Stay blessed.